Hey, welcome to another episode of Talking with Us. Did I wake you up?
Oh, this is scary.
It's early. It's really early.
It's early.
So we do whatever we can to wake up.
We're doing it for you.
All right. So today's topic.
Okay.
Did you introduce yourself yet?
No.
I'm Dr. Paul Zalazan.
I'm Dr. Brad Winning.
Okay. Just in case people don't know.
Yes.
This is Talking with Docs, where we talk about stuff medically related.
Yep.
And sometimes we have guests.
Sure. We're two orthopedic surgeons. Today it's just us.
That's it. Just us.
Topic that we're involved with on a regular basis today, Paul.
Yeah. The question you may be having at home, if you're thinking about having surgery or a joint replacement, is will I need a blood transfusion after my surgery?
Important question, especially in the late 80s in Canada when there was some trouble with what was called the Canadian Red Cross at that time and blood services now, that because the blood, the way it was tested, wasn't able to identify hepatitis C in some of the blood, so then some people got hepatitis C, particularly people that were like hemophiliacs and needed a lot of transfusions, so that was a huge problem. Yeah. Thankfully, the whole process has been revamped now to test, so people are still nervous about blood transfusions, which is normal. Yeah. So what's the answer? Am I going to need one?
Probably not. Okay. Thanks for watching.
Yes. Has it always been like that?
We should dive deeper into it, yes.
A little bit deeper.
So it's evolved. The need for blood transfusions after major orthopedic surgeon has evolved over the last few years, several years, okay? Maybe I'd say even 10 to 20 years ago, it was far more common to receive a blood transfusion.
I'd say 10, even at the beginning of our practice, I'd say.
10 was not the beginning of my practice.
Yeah, 16, whatever.
So yeah, we used to transfuse a lot more frequently. Now we don't.
Like when you say frequently, like how frequently?
Well, you know.
What would the average have been?
Oh man, I don't know the numbers from back then, but I would say maybe 20% of the time.
Yeah, I'd say for me, even with knees, I think it was higher, maybe like 1 in 3. Like it was a lot.
Yeah. Now it's very, very rare. I cannot remember the last time one of my joint replacement patients needed a transfusion.
Well, interestingly, for our...
I thought you were going to say on call yesterday, I had to transfuse one of your patients.
No, what I was going to say is, interestingly, for our continuing medical education, one of the things that I did was I did a self-audit of my practice, my last 100 joint replacements, and I transfused one person, and it was a lady who was over 90 years old and had a slightly lower hemoglobin to start. So, yeah, it is. It's almost zero. It's not zero, but it's close to zero. What? Is it because we're so much better now?
Yep. No, not necessarily.
No.
There's been some paradigm shifts, shift in approach to transfusion in general.
Agreed.
Okay. Before we strictly used to look at the number. Okay. We'd see what your hemoglobin is. The units are different in Canada and the States, so I'm not going to spit out any numbers.
Right.
But you know, we'd look at a threshold and say, okay, it should be higher than this.
And if you dropped, it didn't matter what the deal was, you're below that number, you get a transfusion.
Yeah.
We don't care if you feel perfect.
Yeah.
Right.
Now we take that information into account and we also look at other factors, such as how you're doing clinically.
Sure.
Your heart rate.
Yeah. Do you feel dizzy when you get up?
Do you feel dizzy when you get up? Are you short of breath? Are you having a chest pain?
Right.
We look at the patient overall to determine whether or not they need a transfusion.
I guess in your medical history too, if you've had a heart attack or a stroke or angina or whatever.
Right. And those are the sort of things that we do now to determine if someone needs a blood transfusion. And we have found that people can tolerate having their hemoglobin go down and still be okay after surgery and not require a blood transfusion. Now, do you remember what we used to do? We used to do something called autologous blood transfusion. For a short while, that was a thing.
Right. So what that is when people will come before surgery, donate their own blood, and then we would store it, and then they'd have surgery, and then we'd give it back to them.
Yeah.
And to be honest, when I was in Haiti in 2010 after the earthquake, and because there's no blood system there, people would literally come with like a bag of their own blood, or even their family members' blood, in like an old cooler. Like it was very interesting system.
So the notion was that it'll be much safer for you to give and then receive your own blood. However, it turns out that it has a bunch of risks associated with it.
Right, with the blood itself and even getting the wrong blood, that still is a possibility. Even though you gave yours, you might get...
Which now seems obvious, like, hey, how's that going to work? But at the time, it seemed like, this is the new safe way to do it.
So to answer the question that might go into the comment, should I donate my blood before surgery? No. The answer is no, unless there was a very specific reason, and I can't think of it.
Or it's 2006.
Yes. There's one other thing that really has been game changer for our practice, though. So a medication called cyclocapron, or tranexamic acid.
Right, which is, it's a synthetic enzyme that goes into the clotting process in your body and stops your body from breaking down blood clots, okay? Because after you've had surgery, you're going to make blood clots around the incision, right, to stop bleeding. And then your body may break down this blood clot and cause you to bleed more. So this synthetic enzyme interferes with the pathway where your body breaks down those clots.
Right. So you want the clots or you don't want the clots?
You want the clots around the surgery, you don't want the clots in your leg. That drives me nuts though, because we give medication to stop bleeding, and then we give medication to thin your blood so you bleed so you don't get a blood clot.
It is tricky.
It's
all timing, right? So sometimes it's given intravenous during the operation. Often we'll either inject it into the wound or spray it onto the tissue. So yeah, at the time of surgery, acutely, you want the bleeding to stop. So, and then after that, you want your bleeding to be normal.
Yeah, here's a little unknown fact to many patients, but it's not right now. The use of TXA, or tranexamic acid, I would say is not uniform across the specialty of orthopedics anyways. I was just at a conference last weekend, and the practices are very different.
Really?
Yes. I was at a conference, or really the practices are different.
The second part.
Yeah. So, because there aren't been a lot of conferences because of COVID, but now they're starting up again. So, personally, I give it topically. So after my incision, I will just apply it to the wound. Okay. I know you give it topically and IV.
IV only as needed, though. So if I feel like the case is a little more oozy than normal, then I would ask for it, but not routinely.
Okay, so not routinely. And then at this conference, one of the speakers was saying that he gives it topically, IV automatically, and sends them home with some pills. Yeah.
And the blood thinner?
Yeah. Okay. So there's the practice is very wildly. There's studies being there have been studies for many years. Okay. So right now it's not very uniform. The use of TXA, tranexamic acid, is not uniform across our specialty.
I feel like we've been doing it for about 5 years, and even then, a bunch of people doing it way before us.
Maybe a little bit.
Maybe longer.
Maybe at least 5 years, but definitely it has helped reduce the transfusion rate. So right now you probably will get it in some form.
Yes.
You know what I mean? But just to let you know, depends on who you go to, who's your surgeon.
Yeah, the take-home message is that chances are you're not going to need a transfusion.
No.
And if you do, then the good thing to know, particularly here in Canada, the process of testing blood is just vigilant. So it is safe to receive blood products. I think it's important to know.
If you need it, and the decision has been made that you should get a transfusion. Now, there's a population of people who do not wish to receive blood transfusion for religious purposes, and we do recognize that, and we respect that, and we work around that as well as much as we can. So we don't mean to offend anyone who is personally against any kind of blood transfusion. Totally respect that, and we've come across that quite often in practice as well.
So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.